Now in the sagittal plane, as we reach forward, there's one more thing that we need to consider, and that's the impact of the rib cage. So as I reach forward, I've got options as I reach forward. I can do this with a depressed rib cage. So when I depress my rib cage, I'm also going to help posterior tilt my pelvis, which is going to take tension off my proximal hamstring. If I reach forward with an elevated rib cage, that's going to anterior tilt my pelvis. It's going to put more tension through my proximal hamstring. So if you imagine doing an RDL exercise with a proud chest, I'm going to feel a lot of tension in my hamstrings. If I depress my rib cage, now the tension's off my hamstrings, okay? So the elevation of the rib cage as I lean forward is going to put more stress through the proximal hamstrings. As I reach forward with a depressed rib cage, that's going to take tension off my proximal hamstrings. When we look at the studies such as this study here, it was by Pryor et al. Peter O'Sullivan was involved in this study, and they looked at the muscle activation levels they looked at the influence of the changes in trunk and pelvic posture and what that done to the kinematics of the lower limb. So again, what they found here is when we lean back, that's going to use more quads, it's going to use less glutes. When we lean forward, it uses more hip, just like we've said. When we reach this way, it uses more glute med. Again, challenge basis support. My glute med has to decelerate my body weight. Again, it's not rocket science. When we reach this way, we're going to use a little bit more adductor, or we're going to be able to use less glute. So we're going to have to use more distal tissues, okay? Then the other thing was when we move the ribcage this way, we're going to use more medial hamstrings. When we twist this way, we're going to use more lateral, okay? And again, that makes sense. If you think about your medial hamstrings and your adductors, when I go this way, I'm putting these tissues in a better length-tension relationship to contract. When I go this way, I'm shortening these tissues. I'm putting slack into the system. They're in a shortened position. It's harder for them to do work. So I'm probably going to focus more, or my nervous system is going to choose to use my biceps fem, which is in a better length tension relationship. So what we could do with this knowledge of the lunge is, for an MCL, for example, this will be the middle progression. If I want to deload my MCL, I could get my patient to reach this way, which is going to create momentum this way. So you can see I'm not going to get a valgus. That's also going to put more load through my biceps fem. If I want to progress with an MCL, I can get my patient to reach this way, which is going to put more load through my medial hamstring, and it's going to create that valgus, and it's going to put more load through the MCL. So that would be the progression. So you can see now we've got a middle level, we've got a progression, and we've got a regression, depending either on the tissue or the structure that we want to stress. If I want to get more medial hamstring, then I want to be looking this way rather than that way.